Hello, everyone. Welcome to Lyme Disease 101. I'm Jen Hyla, an author, a speaker, a coach here, separating facts from fiction to educate and empower patients. Before we get started, I just wanted to share a little bit about me. I am a field biologist turned late-stage Lyme survivor, advocate, and recovery coach. I contracted Lyme disease in 2011 and was misdiagnosed with arthritis for 4 years. I started developing neurological symptoms and was kind of bounced from specialist to specialist, and eventually asked for a Lyme test in 2015 and was diagnosed with late-stage Lyme disease. Now I'm very passionate about sharing my experiences, healing from Lyme, and mentoring others with Lyme or suspected Lyme to provide new perspectives, alternative treatment options, and really help others skip the mistakes I made. So I work from the knowledge that the human body can heal from anything. I truly believe that you can find well-being no matter how long or how badly you've been sick. So what to expect today? I'm going to share some of the things that I wish I had known when I was first diagnosed. So we're going to learn what Lyme disease is, how it works, how Lyme disease is spread, how Lyme testing works, the Lyme treatment controversy explained a little bit, tips on finding a Lyme specialist and support. And before we get started, just disclaimer, I'm not a medical doctor. This slides have not been reviewed by a medical doctor. All the training material provided here is for educational purposes and not reflective of any brand I'm affiliated with. These are my views reflective of my experiences and my research. Definitely should not be taken in lieu of medical advice, but I am hoping to educate and empower patients to have those tough conversations with their medical team. So what is Lyme disease? Lyme disease is known as the great imitator, and that is because it can mimic over 300 different illnesses. It is very complicated to recognize and diagnose. It's caused by a bacterial infection, and that bacteria is known as Borrelia burgdorferi. You're going to see it as BB on the slides. It is a very complex spirochete bacterium. BB is one of 36 species of Borrelia, and then there's hundreds of subspecies. So for instance, I have Borrelia burgdorferi and Borrelia recurrentis. So hundreds of those subspecies and 36 confirmed different species of Borrelia. All species of Borrelia are very complex. These are the most complex bacteria on Earth. They have the ability to adapt quickly to new environments and evade the immune system. How do you get Lyme disease? Lyme disease is a vector-borne disease spread through insect bites, congenitally and through blood transfusions. Although it's commonly spread by tick bite, mosquitoes, sandflies, spiders, and fleas have all been found to be carriers. Live spirochetes have also been found in tears, saliva, vaginal excretions, and semen. So sexual transmission is widely speculated in the Lyme community, but research is sparse, and the animal studies that have been done are not proving sexual transmission is possible. How does Lyme disease work? So Borrelia burgdorferi enters the bloodstream in a spirochete or S form, and you'll see it there on the screen. It looks like a little corkscrew or worm. It quickly is able to adapt to its new host. So if it's coming from the tick, it can change that, like adapt the pH changes, sugar changes, all of that very, very quickly. It in this S form, it can burrow through any tissue, bone, into the central nervous system and brain. As the S form disseminates and spreads throughout the body, it also starts spreading or shedding this outer proteins called blebs. These protein blebs confuse our immune system. Our immune system starts going after the blebs while the corkscrew's swimming away. And those blebs can actually attach to our healthy tissues confusing the immune system even more into attacking healthy tissues and actually create a type of autoimmune response and widespread inflammation throughout the body. How does Lyme disease work? So that S form, that looks like the little corkscrew, it can also curl up and completely lose its cell wall to become a cyst or round body form. This is a very clever defensive mechanism for this bacteria because most antibiotics work by attacking the cell wall. I'm going to show you a little clip here if it will play. Okay, so we are gonna watch this little short video here. These are two spirochetes on a petri dish under a microscope. And what they're doing is washing the slide with penicillin. And so you can see the spirochete here, not really liking the penicillin, the antibiotic. So what does it do? It goes into a cyst form. This is the round body form, cyst form. It loses its cell wall. So they're going to show it to us in slow motion. And then, yep, it's just, now it's a cyst form. And you can imagine how painful that might be if it's in your body doing that. So once it's in that cyst form, it can also develop a biofilm to protect itself further from those antibiotics. So if they're just washing the slide, it starts to get this little biofilm around it, and that can even protect it further where antibiotics cannot get to it. And biofilms are not unique to Lyme disease. A lot of different bacteria and viruses create biofilm. And this is a little microenvironment where many different bacteria and viruses can multiply. So no matter what stage or form the bacteria is in, your body's working very hard to attack those outer protein blebs, which have attached to your healthy tissues. They're spreading around the body, the bacteria itself that's spreading around the body, and these biofilms where a host of viruses and bacteria and fungus can grow. It's causing widespread inflammation throughout the body and a long list of symptoms. So there's also other tick-borne infections and co-infections that come along with Borrelia burgdorferi. So it can get, your treatment can get quite complex. The bacteria that cause Lyme disease, Borrelia burgdorferi, have a lot of toxins inside them. So when we start taking these drugs and antimicrobials and whatever we're doing to kill off that bacteria, massive amount of toxins are released into our bloodstream. So those toxins can cause an overload to the system and an increase in all kinds of symptoms. This is known as a Jarisch-Herxheimer reaction. It's more commonly referred to as a Herxheimer or Herx reaction, die-off reaction sometimes it's called. These Herx reactions can be extremely uncomfortable for hours or days, and in extreme cases, it can actually cause seizure, stroke, heart attack. And so supporting the detoxification system is really crucial to keeping those toxins flushing out of the body and reduce the risks and the symptoms involved in Lyme treatment. How does Lyme testing work? The standard test is known as a two-tiered Western blot test. This is reliant on antibodies that are not always produced in the body, especially during the early stages and possibly even into the chronic stages when it's when the bacteria has hidden out in our joints or the biofilm and those antibodies are not being produced. So the way the Western blot test works is it's a two-tier test. So they take your sample, they test it through this EIA or ELISA method. If you get a positive test there, that's going to warrant further testing with the Western blot method. So that's going to look for the reactivity to specific proteins that have been associated with Borrelia burgdorferi. So previously the CDC has required that you get that positive ELISA test, the sample's further tested with the Western blot, and you need 5 out of those 5 antibody bands to be considered CDC positive. While Lyme experts have said, you know, if you get one of those reactive proteins, that's proof enough that you've been exposed. And so there's been some controversy there. And then in 2019, literally as my book was getting sent to the editors, the FDA and the CDC approved this new test. So this new enzyme immunosorbent assay test is going to replace the Western blot test. So it's known as Zeus, and it was just approved a few months ago to replace the Western blot test. So it's going to be interesting to see what the Lyme community says about that, because this EIA method, you're essentially having 2 tiers of testing now that are only looking for that antibody response, and it may not be better than the Western blot, but time will tell. So there's another test, a newer test known as PCR testing. This is not reliant on antibodies. What they're doing here is actually taking your sample and looking for the DNA of the bacteria or virus or whatever you're looking for. So in this case, it's Borrelia burgdorferi. They're gonna take your urine or your blood, and they're able to see those proteins of the DNA, of the bacteria, excuse me, in the sample. So most Lyme experts are saying that Lyme disease is a clinical diagnosis and it should be based on your symptoms because of the inaccurate testing. So that ELISA Western blot test is said to only be picking up around 50% of the cases, and this PCR test still isn't even perfect. So, and also the PCR test is so new that most insurances will not cover it. I personally had to pay $600 out of pocket for mine. So yeah, clinical diagnosis may be your best bet. This symptom questionnaire I've linked here is by Dr. Richard Horowitz. He can, it really is a wonderful tool to help you track your symptoms, track your progress, and also to determine if you are needing to go see a Lyme specialist. If you just have suspected Lyme, you can take this questionnaire. I'm going to make these slides available to you, and you can just download that. I recommend keeping one on your computer because the testing is so inaccurate, and if you have these antibodies, you're going to always have the antibodies. So there's no test to determine the success of your treatment. So having this tool to just say every couple months check in and look at where you were and look at where you are now, and can help you determine what treatments you need. So why is Lyme treatment controversial? This slide could probably go on all day. I could talk for a while about this, but I'm just going to skim the surface. There's resources at the end of this that will allow you to dive a little deeper if you want to go down the rabbit hole of controversy. But the basics are that Borrelia is a very stealthy bacteria. It has defensive mechanisms and the ability to evade our immune system. So chronic or late-stage Lyme disease may require multiple treatments. But if you catch it early enough before it disseminates throughout the body, if you've got a strong immune system, people seem to be able to, a percentage of the population is able to take that early treatment, 2 weeks or 4 weeks of antibiotics, and be fine after that. So despite thousands of peer-reviewed studies proving that there's these high treatment failure rates, there's testing failures, the CDC has maintained a stance saying that Lyme disease is easy to diagnose and easy to treat. So if a Lyme patient is still experiencing symptoms past the CDC protocol, they're told now you have something called post-treatment Lyme disease syndrome. So Lyme disease is the only illness I've ever heard of where they give you antibiotics and then you stop the antibiotics before you're feeling better. So these treatment protocols do not take into account how long a patient's been sick, any of the co-infections that may be coming along with it. It doesn't take into account the immune response and inflammation that's going on. They just give you 28 days of antibiotics, and if you're still feeling sick, now you're told you have post-treatment Lyme disease syndrome, and there is no medical code for post-treatment Lyme disease syndrome, and there are no known treatments for post-treatment Lyme disease syndrome. So they're just kind of leaving patients high and dry. And the Lyme groups and scientists really disagree with how the CDC has handled Lyme disease, the protocol, and the description of post-treatment Lyme disease syndrome. The International Lyme and Associated Disease Society, known as ILADS, have created a training protocol for doctors who are wanting to treat outside of those guidelines, and they are called ILADS trained doctors or Lyme literate physicians, and they all must agree that treatment must be dictated by how the patient feels. And you know, part of the controversy is that our insurances go through the CDC protocols. So if your doctor is wanting to treat you outside of those protocols, they can actually be held liable for unprofessional conduct. And many Lyme doctors have gone bankrupt and actually lost their medical licenses. So where can you find a Lyme specialist? Because it is controversial. You can't go on to your insurance website and look for a Lyme specialist. You have to go through the ILADS website and to see who has gone through those training courses. You can go to ilads.org and they are going to ask you for your zip code. You put it in and they email you 3 randomly selected options within a selected radius of your zip code. But before you do that, I highly recommend that you get on Facebook to your local Lyme support group and search and ask, you know, who are they going to see? Because that ILADS website is just randomly selected doctors and it doesn't email it to you right away. It could take hours or days to get those results. And if you go to your local Lyme support groups, there's going to be, you know, more information about those doctors, and you may save some money and time and energy. And full healing may require multiple doctors. They kind of get their own tunnel vision. And you know, these Lyme literate physicians, they've only just gone through a 2-week training course with ILADS. So I have found that they kind of they find the modalities that work best for them, and then they don't really go outside of those. So don't be afraid to move on if you're not feeling heard or seeing results. After each appointment, ask yourself, did you feel heard and respected? Did you leave feeling confident and supported? And were your top concerns addressed? So don't be afraid to have multiple different doctors helping you on this healing journey. And on top of all the physical and cognitive symptoms, living with Lyme disease can feel very isolating and depressing. So surround yourself with compassionate and inspiring people that feel good to be around. Distance yourself and let go of toxic relationships that feel draining and insincere. Seek out emotional support from your local Lyme community, from your churches, your loved ones very often. Find an understanding therapist or coach or mentor that you can speak to regularly. Don't waste energy trying to do this on your own. Here's a few resources for you to get further educated. The ILADS website, Global Lyme Alliance, Lyme Disease Association, and the Bay Area Lyme Foundation all have really wonderful education pages on their website. Here's a few books that I really enjoyed and found a lot of helpful information in. And a couple documentaries, Under Our Skin 2, Lyme Crime, The Monster Inside Me. I do recommend taking all this information in small bites. I literally just overwhelmed myself while I was trying to heal and understand Lyme disease. So seek out support, take breaks, learn little bits as you can, and remember those documentaries are sensationalized and dramatized. So don't overwhelm yourself while you're trying to heal. I have some free download for you, 10 tips to manage a Herxheimer reaction. I've got my 20-day online group training and support program to help anybody who's new to these detoxification methods. I have a blog, the LYME blog. I also offer 4-month coaching packages, and these slides and the links will be down below. So that's it, Lyme 101. Thanks so much for joining in, watching with me, and I wish you happy healing. Reach out if you need support in kicking Lyme's butt. I'm Jen Hyla. I am a speaker, an author, a Lyme advocate, and recovery coach, and I will see you next time. Until then, be well.